Manasseh, we're going to wrap up with you. We saw earlier on some of the innovations that's happening in Rwanda. Can you talk a bit about the work that you do at Society for Family Health?
Thank you very much, Fred. At Society for Family Health, we are the biggest non-government organization building healthcare at the community level. When I met Fred for the first time and he visited one of our clinics, he asked me how we are able to get the information from each of those clinics. I told him we get monthly reports from each of the clinics. And he told me that there is a better way. We can be able to get instant data and information about each of those clinics, about each health worker in just an instant. And I asked him how. He showed me on his phone, and he was showing me what he's doing across the world. And then I said, how can we do this? So the rest is history, is what he was showing you here. We have a health intelligence center, 300 clinics connected. In fact, as a result of the data that we have been collecting and making decisions, we have unlocked funding from Takeda of about $5 million to do more clinics. So we are using data to make decisions real time, not like 2 months or 3 months, but instantly.
So we began this project with Manasseh and his group of 300 clinics, and that was the initial pilot. And the government of Rwanda was so impressed that they asked us to do this for the whole country. And that's how you saw the National Health Intelligence Center we just showed with 4,000 clinics and hospitals, right? But it started working first with Manasseh's network of 300 clinics. So last thing, and then we wrap up this keynote. Today, many leaders in this room are grappling, right, with budget cuts, with a shortage of personnel, and ultimately how to do more with less. In Rwanda, you've had to deliver world-class healthcare with much, much fewer resources than the US has, right? So what can people in this room from countries that have many more resources learn in this moment where they have to do a lot more with less from what you've done in Rwanda?
Thank you, Fred. And number one is that personally, I have been able to cut our expenses by 50% because of the data that we are able to get and make timely decisions and delay some diseases or some kind of inefficiency that will be coming in. Number two, Fred, you and I know that using the Health Intelligence Center that you helped us build, the ministry officials were able to come in and saw how actually you can optimize insurance, the health insurance. They came and saw that actually when the health insurance expired, people were not going for services. And that means diseases, of course, delayed production, and missed opportunities. And when they saw that actually still the person will pay for the insurance, they said, why not actually change the policy, adjust, and allow people to pay when they are able to pay, but still receive services. So a fundamental policy shift. So there is a lot that you can do with real data, real time.
Thank you. So if this is happening in Rwanda, you have no excuse to be able to do it in the United States, right? And this is why we're here at SAN, and we're looking forward to collaborating with you. So thank you very much.
Thank you.
Thanks so much.